Hey everyone, thank you so much for joining us. I am Kayla Lafferty, Public Information Officer with Seattle Fire Department, and we are here for another episode of our Fire Connect podcast. And just a reminder, the application window opens October 4th for people thinking about becoming firefighters. You can visit seattlefirejobs.com for more information. Today, we're going to be talking about two different programs within Seattle Fire Department, Medic One and Health One, both very different programs, but very important. We are joined by Senior Paramedic Alan Goto as well as Lieutenant Leonardo Castañeda. Thank you both so much for being here with us. And we're talking about some really cool things with Seattle Fire Department today, Medic One as well as Health One. So thank you both so much for being here today, taking time out of your day to talk with us, especially you, Senior Paramedic Goto. You're coming off a long shift, so thank you. We appreciate it so much. Let's start off with just an introduction. We'll start off with you. How did you end up working with Seattle Fire Department? Tell us a little bit about your journey and your story to get here.
So I really wanted to be a firefighter since I was like 5 years old. Like when the fire engine came to my kindergarten class or whatever, first grade, that was really the moment that I decided, like, this is what I want to do, even though I didn't know anything about it. And so just kind of my journey was just following that path up until the point when I kind of got the, was like brave enough to take the test and apply because I had made it feel like such a daunting task. In the end, it worked out for me. I made it in 1998. I started recruit school here. I was assigned right to Engine 9 up in Fremont, where I worked, and I loved it. It was, like, thankfully, really what I wanted to do. I discovered that along the way as I learned more about doing this job. And for 14 years, I worked on a fire engine or ladder truck here in Seattle. And in that, my 13th or 14th year in the fire department, I kind of, although I'd seen the paramedics work and worked with them so many times, that was when I really decided, like, I think I'd like to try that. And so I, again, like, went through the process of taking a test and going through interviews and was accepted into the paramedic training program and spent almost a year there. And I've been doing that ever since. So for about almost 13 years now, I've been a paramedic. And as another part of doing this job, this fire department job, it's been just great. My whole time here, 26, almost 27 years, has been extremely fulfilling and everything that I was hoping it was going to be.
Oh, that's so cool. Now, Lieutenant Castañeda, tell us your story. How did you end up here?
Well, it was a long journey. I was born and raised down in Medellin, Colombia, South America. I moved to the United States at the age of 18. Sponsored by my uncle. When I first arrived to Seattle, I didn't know how to read, write, or speak English. I feel obligated to learn the culture, learn the language, and during the process, I attended Chief Sealth High School, and I told one of my teachers I was working full-time. I had 2 jobs, working full-time and going to school at Chief Sealth. And I told one of the teachers that someday I would like to do something greater than myself to help people, and that was trying to be in the fire department. I thought that was a cool idea to get in the fire department and become a firefighter medic. And so the day came, the Seattle Fire Department hosted a career fair at Chief Sealth High School. Unfortunately, I was not there because I was working, and so I missed it, but the teacher had kept me in mind. Get a business card from one of the representatives from Seattle Fire Department. I make a phone call. I contacted her, and she said, yeah, why don't you come down to Station 10, where I met one of my best friends in my wedding. He was the mentor for the fire department, and he's also kind of the father figure that I never have. I was raised by a single mom, so he actually took me under his wing. His name is Roy Mason, Bear, Ladder 1 D shift, and he's like, hey, do you have your CPR and first aid card? I said, nope. Well, make sure you get that. Do you have your EMT? Nope. Well, make sure you find a way to get your EMT. Find a volunteer fire department so you can kind of experience firsthand and see if you really want to do this job or not. So I took that to heart. I take notes. I was amazed what he showed me at Station 10 and the camaraderie, the family environment, and I said, I want to be part of this. So I started working hard through that. I put myself through North Bend Academy in 2003, and that was a $9,000 investment out of my pocket. So that was the commitment that I have for the fire service, that I really want to be here. I volunteered for White Center, the next door in North Highland, for 7 years. And then I took the test to Seattle 10 times. So I find people in the testing process say, oh, I'm not going to take this no more. And I say, well, I'll be here next year. I'll be here next year. So what I learned is it's not my time, it's somebody else's time. There's a right place and time. So I didn't get discouraged. I was just working on my resume, building my resume, and I would continue to improve myself. And then here I am. I've been in here at Seattle Fire for 15 years. I study hard, I work hard. I got through the promotional process, and now I'm a lieutenant here in Seattle Fire Department, and I'm very grateful and blessed to be working with the people that I work every day here in Seattle Fire Department.
That's such a good example of mentorship, but not only that, like the importance of mentorship, but also of commitment and sticking with it. If you have a dream, like really following through on that. Not getting discouraged. I feel like it can be so easy to sometimes say, oh, it didn't work out, it's not meant to be, but you stuck with it and look at you now. It's amazing. All right, now, Senior Paramedic Goto, so part of SFD's Medic One program, I mean, that's a big part of your career. You just explained that. Talk about what Medic One is and why it was something you decided, I need to be part of this.
So Medic One, or the paramedic program here in Seattle, is our focus on the emergency medical service in the advanced life support category. We've got our entire department, everyone is certified as an EMT, and most of the medical emergency calls are handled by the EMTs. They can do, I would say, 80% of the work for medical 911 calls on their own. They're highly trained and have a lot of experience. But what I do as a paramedic, what the Medic One program is about, is for that smaller percentage of people who are critically ill, and without being too dramatic, but like truly in a life or death situation in that moment. And so Medic One focuses our training and equipment and education around the most sick patients that end up calling 911 here in the city, how to care for them and get them maybe stabilized, some of them stabilized, and to the hospital.
So the difference between an EMT and a paramedic really is that level of training and the sort of calls that you would respond to, correct?
Correct. We all respond on the medic responses. The EMTs will respond a lot of times on their own to what we call BLS, or basic life support calls. But when a dispatcher identifies these ALS calls or medic responses, or the EMTs in the field identify a patient as requiring paramedic level intervention, then we all respond together. So firefighter, EMTs, and paramedics are all there on the same call, working with the same patient. One of the biggest differences right off the bat, and you mentioned it already, is the amount of training. I teach our EMT school here, and it's always about 170 to 210 hours of training over the course of a few weeks. And it prepares you, like I said, to take care of most patients that call 911 here in Seattle. But if you choose to go the route of Medic One and go to paramedic school, that's a few thousand hours of training that takes place over about 11 months. And it's a very intensive program. It takes up kind of all your time for that 11 months. And the amount of experience and education you gain in that training program is what really makes a difference, not just between a paramedic and EMT, but really the paramedics here in King County who benefit from this program that does go above and beyond what the kind of national standard is.
Yeah, and we're going to talk about that in just a moment because truly the Medic One program here in Seattle is amazing, world class. But before we get to that, back to you, Lieutenant Castañeda. So you work with Health One. This is a totally different program than Medic One. Can you explain for me what Health One is? Same question that I just asked Senior Paramedic Goto, and why you wanted to be part of Health One.
So Help One is a co-responding respond unit that is involved firefighters as well as a case manager. The case managers are supervised by Aging and Disability Department, Human Resources at Seattle, City Seattle. And what it does is first responder or the unit will respond to an A call, and they scan the situation, the living conditions, and everybody in the department is being trained on MIH, Mobile Integrated Help. So if they see they need or they see the fit for us to come in and evaluate the situation in this patient's house, or they can benefit from Help One, they will do an MIH, and then we'll have the time we can spend an hour to 2 hours to trying to make a difference in this patient's life. It could be from mental health, substance abuse, or vulnerable adults that they're living in poor conditions. So Help One is a co-responding unit that's trying to mitigate and help navigate the system and connect people with resources.
And why was Health One something you decided, this is something I want to be part of? This is a step I want to take in my career?
Well, just like I said before, growing up in Medellin, Colombia, it was when I was a child, I was raised by a single mom and I was super poor. So I know what poverty is and I know what suffering is. So to me I've been blessed to the fact that I'm here in America now, living the American dream. Now I can give back. So Help One was kind of in my alley because I can relate to these people. I can relate to whatever they're going through, and I can shine a light of love and compassion to these people, along with a good group of people, the firefighters that work in Help One.
So back to Medic One, as a paramedic, you respond to incidents that have some of those more complex medical needs, as you mentioned prior. So explain for us the type of calls that might warrant a medic response versus something that, firefighter EMTs can handle on their own.
So, I talked a little bit earlier about, so the firefighters handle most things. So most car accidents, a lot of broken bones, again, all of the different things that can happen, less serious, penetrating or other trauma, wounds. The firefighters handle all of that stuff, and they do a fantastic job. The types of calls that we go to as paramedics, one of our top responses are anything to do with acute cardiology, so any heart attacks or pathologic tachycardias. We deal with patients with severe strokes, unknown level, consciousness levels, why is somebody unconscious and we don't know. We deal with very serious trauma, usually life-threatening trauma. That makes up the bulk of the types of calls that we go to.
And we briefly touched on this, but going back to it, Medic One really does have a world-class paramedic training program. And it's in partnership with UW-Medicine, which is really cool. Can you talk about the experience of going through that training, the Medic One program, working with UW-Medicine and all of that to become a paramedic?
Sure. So when I decided I wanted to be a paramedic, there's a little bit of a testing process and some interviews because the medical director and the chief of the Medic One battalion, they want to know who it is that they're bringing on board. But once accepted in, you start getting ready for paramedic school. You start by taking a anatomy course, and it's all done through the paramedic training program, which is a part of University of Washington School of Medicine. And you're doing it with your paramedic student classmates or soon-to-be classmates. But it's all, again, through the University of Washington. It's a university-level course, college-level course. And that's done while you're still kind of finishing up your time as a firefighter. So you're going to school and still working on the fire engines a little bit. But every year we start school in the beginning of September, which is actually I think they're starting school next week. And then the paramedics all show up, and what they've all done is they've been released from duty They are no longer assigned to any fire engines. They are expected to spend their full time, full amount of every week in paramedic school. And for 11 months, you kind of just live that life. You spend a lot of time at Harborview, going to classes. You attend courses, lectures, and classes that are taught by physicians or experienced and senior paramedics. There's a lot of clinicians involved in the training and education of the paramedics. You start right away learning some of the skills that you need, like IVs, intubations. And what's so good about the partnership between University of Washington and Seattle Fire Department to help you learn the skill is that Children's Medical Center, Harborview Medical Center, University of Washington Medical Center, those places are all open to you to help you further your skills and experience. And it's not uncommon to learn a skill, like IV skill, and then later that day you were over in the emergency room, again as part of your training, starting IVs on real patients, helping the nurses, being supervised by physicians, and really learning your craft that you are going to take out on the street. Another big component of the training program is the internship or ride-along time. School starts in early September, and usually right around October 1st or 2nd, you start working shifts on the Seattle Fire Department medic units. Primarily, it's going to be Medic 1 and 10, which go right out of Harborview because they're the busiest units, medic units that we have in the city. And your role as a student on the medic units evolves as you go through training. So in the beginning, in your first few days, the expectations are not high that you're going to help out much, but you do a lot of observation. Senior paramedics and instructors will review all of the calls that you went on and talk about, well, this is why we did certain things or didn't do certain things. And as you learn more, that expectation grows. And so as you become proficient in your IV skills, we'll now have the students like, okay, we're going to start an IV on this patient like you started. I'm going to watch you and I'm going to help and I'm going to make sure it all goes okay, but it's your turn to do it. As they learn to do intubations, it's the same process. We make sure that our students at the beginning of the shift are, prepared to handle critically ill patients, and then we're right there with them, partially to help and evaluate them, but also to give them a little bit of confidence, like they're trying a new skill on real people who are truly injured. And we want them to have a little bit of confidence, like I'm right here with you, like we're going to do this together. And so that evolution continues through the 11 months until by the end, in the last few months, they're really doing everything on their own. The students, we're still supervising them and just making sure it all goes the way it's supposed to go. But the students have got so much experience, so much training, that they're doing these calls by themselves. And it all culminates in about 6 weeks of physician evaluation. So on every medic, or not every medic, on Medic 1 and 10, every time we go out on 911 response, there'll be 2 senior paramedics there who are there to watch and do some preceptorship. The 2 students that are going to run the call as much as possible, just on their own, and then there's a physician who's there to evaluate them, and that's the final step of the training program. So in the end, if an emergency medicine doctor says they're okay to do it, then they get to put the uniform on and they come out and they can do it on their own or with a senior paramedic partner.
I went on a ride-along when I first joined the department. Went on many different ride-alongs with different programs and stuff like that. One of them was with Medic 1, and it was 2 of those paramedics in training with the 2 senior paramedics, and it was really cool going on these calls, watching them learning on the job, truly, of what different calls to make, how to go about it, getting that confidence, and then after, discussing everything, and during, of course, with those senior paramedics was such a cool experience for me to witness. And it truly shows all of the different, knowledge and experience that goes into it. It takes a lot to become a paramedic. So much gratitude for all of you and everything that you do. And kind of on that note, it's an amazing job, obviously. It's also really hard. What is so fulfilling about the job of being a paramedic for you? What is it that makes you come back every day and say, this is something I love?
So that feeling for me has changed a little bit in the course of the time that I've been doing this job. I do look back on my time when I first decided I wanted to do this, and I was a firefighter, and I'd been on a lot of responses with paramedics, and I'd seen them do their job, and I'd assisted them in a lot of procedures and transport to the hospital. But until doing it for myself, until experiencing the training, and then as a graduate of the program, I feel like I didn't know what I was really getting myself into. I knew that I was like, oh, that seems interesting, I'd like to do that, but I didn't really realize what it was about until I was actually in there doing it. And so the things that attracted to me at first was the challenge, the challenge of like going through school, the challenge of taking that responsibility for people who are so sick and so injured. And I'd seen such good outcomes from paramedics that came before me, and I just thought it would be amazing to be able to do that. And that's what attracted me to it at first. What really keeps me here is, or not necessarily keeps me here, but keeps me feeling so good about doing this job, is that you really do make a difference. The responsibility for these incidents is on the paramedics that are on scene, and it sounds like a lot sometimes, but the training is so good. My training was so good that when you come out of that program, the responsibility feels just like your job. It feels like you're ready to do it. It feels like you have the knowledge and the equipment to take care of these people. And so the responsibility, although a little heavy, isn't daunting. And then having that responsibility and being able to see these outcomes and truly be able to help people and make a difference is something that is, one day when I retire, I think it's going to be hard to give up.
Yeah, I can imagine, only imagine. So speaking of training and the process of becoming a paramedic, a big supporter is the Medic One Foundation. Can you talk about some of the stuff the Medic One Foundation does to benefit Medic One in general and people trying to become paramedics?
Sure, yeah. So, I have to start out by just saying that the Medic One Foundation is integral to the training of paramedics. Like we just couldn't do it without them. They're a 501c3 nonprofit organization that really started with the beginning of our program in 1969, 1970, something around there, when this was still a new and untested program, having paramedics. It was new basically in the entire country. There weren't a lot of paramedics around. And the city government at the time, not today's city government, but city government at the time chose to not fund the program. When the money ran out, they were like, well, it looks like this program is over. And so the medical director, back in the 70s, the medical director helped start a movement to fund the paramedic program through donations from the people of the city of Seattle. And that was the start of the Medic One Foundation. And that foundation has continued on this whole time. And through donations from private citizens, they fund the training for all the paramedics in King County, and a few paramedics even outside of King County. What's good about that program, because you would think like, well, this should be paid for by taxes. What's good about that program is that the management of the training and the management of the finances to train the paramedic students, the responsibility for that and the decision-making is through the Medic One Foundation in close contact with medical directors from the different fire departments in King County. And so that training can remain focused on the paramedic programs without too much thought for political, anything to do with politics or who might be in city government these days. So Medic One Foundation is really important. I am always thankful for what they did for me because I couldn't have done this without them.
So back to Health One, the program was launched in 2019, of course, as you mentioned, with the goal of providing immediate care and resources for individuals in need. Lieutenant Castañeda, can you explain the types of calls that Health One would be dispatched to?
So Help One is, like I said, is mainly referral by ops. So the ops are first on hand, and they got the training and the resources and are about what is a good fit for MIH, what is a good fit for Help One, and then they normally call us on scene, and if we are available, we respond to the scene. We talk to the officer in charge. He gives us a rundown of the firefighters, because most likely they activated from the 8 cars, so firefighters are the ones calling us and say, hey, we got this situation. So we go and we meet and say, okay, you guys can go back in service, we'll stay with this patient. And then the case managers start doing their case manager work, which is amazing. But the case manager can't do their work unless we have firefighters to support their needs. But it's pretty much low acuity. We don't go code red unless totally unnecessary. There's been a few times where ops will call us code red because they're dealing with somebody in mental crisis, and our case managers are pro on dealing with this kind of situations, and they have a different type of training than firefighters do. So together we make this co-responder. We make a pretty awesome team to go and mitigate that situation. And the coolest thing about the Help One is we have the time. We don't have to be rushing anything. So we can be on scene from 1 hour to 3 hours. And sometimes some of those calls, they're very complex. There's a lot of paperwork involved. There's a lot of, dealing with the police, dealing with other social components in the system that we had to put together, filling applications, filling referrals. So that takes time. And then also Help One is one that a company will go and see this person over and over, calling for 911. And the person might not understand what the 911 system is for. So we go and meet that person at their bases and kind of explain and say, hey, if you need this, this is what you do. If you need this, we can connect you with this. So to kind of reduce the low acuity responses, so the engines, the trucks, and the medics can be free to go to other emergencies. So that's what the Help One is. And I think a lot of the departments in our surround area, as well in the nation, they're kind of copying this model from Seattle Fire, which is pretty awesome. And that's one of the things I love about Help One, that we got a great group of people, case managers and firefighters, and also officers. We got a lot of lieutenants in our pool, a staffing pool, which is awesome. It's unique to see.
You brought up exactly my next question, which is Health One has a staffing pool system. So, which means it doesn't necessarily need to be a permanent assignment, something that you're doing for all of your shifts. Can you explain that and why that's, appealing?
So the beautiful thing about Help One is a group of people. We get the training through John Ehrenfields is our director for Help One, and so he put us through some rigorous training on mental health, crisis intervention, suicidal, and how to deal with these kind of individuals and how to do the vulnerable adults. And so he shows all this training, and then once you are trained, now you can put in for days that you want to work for Help One and staff the rigs. So it's very clear. We do the scheduling at a month in advance. And if you see in the calendar, say, oh, I see a case manager but doesn't have a firefighter, that case manager needs a firefighter in order to do their job. So sometimes I've been looking at that and say, I can work tomorrow after shift, so I go and staff the rig, and then we go in and see all the referrals given by ops the day before, and then we go see these patients and figure out what are their needs and wants, and we try to accommodate those.
Another part of Health One is Health 99. Can you explain what Health 99 is?
So Health 99 is a totally separate, it's the same umbrella, but it's totally separate. Help One, Health 2, they're part of ops. They belong to the whole entire city. Health 99 was ordered by Mayor Bruce Harrell as a executive order last year to deal with the high cost of overdoses. So Health 99 is continuing to evolve. It continues to learn. We have one of the case managers. She is the leading on the overdose here in Seattle, Riley Hub. And I think right now we're making such a headway nationwide because now we're trying to get the EMTs trained on buprenorphine, which it helps with this overdoses. What it is a block the, just stop the craving for somebody an overdose. It stops the craving for at least 24 hours to 48 hours. And that will buy time for the case managers to connect this person into treatment or rehab and other stuff. So I think it's awesome. I love that part because every day is a new beginning. Every day I go on Health 99 is giving a chance to that person to, hey, we have a path for you. You just got to walk it. But we can walk it for you, but we're here for you. So it's kind of unique, And every day I go there, I'm trying to reset my mindset and say, today I'm going to give the opportunity to that young person, that young lady, or that young man to get out of the drugs, to walk to the path to rehab. So.
Yeah, so both Health One and Health 99 are kind of on the forefront of nationwide, steps that are being taken to better people's lives. That's got to be really cool to be part of.
Yes,
kind of the beginnings of stuff that people, are looking at and modeling their programs after.
It's very rewarding. I have just one call that it resonates with me, and I always keep it in my head, is we go to an overdose on Health 99, attended by 8 car, 2 firefighters. They bring this person that was overdosed unconscious unresponsive on 3 Avenue. And when Health 99 got there, the patient was already awake with stable vitals. We released the 8 car so they can go on another 8 runs. And we stay with the patient, and after 20 minutes of talking with the patient, the patient looks at me, have you been in the service? I said, no, sir. I said, well, thank you for saving my life. And then he told me about how he got to that point, that he got out of, he was suicidal, so he got out of the treatment for 3 days, and he joined a group to smoke some grass, thinking that it was weed, and then all of a sudden he was unconscious. But then he said, thank you for saving my life, because I've been deployed to Afghanistan and Iraq 2 times, and I see my best friend blow it up in pieces. So that was a ex-Marine telling me, thank you for saving his life. So that to me is, that's the reason why I want to be part of this team.
Yeah. Oh man,
that was heavy.
Me emotional, like
that was heavy.
You both of you truly are making, saving lives, which is incredible. And what traits do you think would make a firefighter, EMT, or just anyone that's thinking about joining the fire service a good fit for working for Health One or Health 99?
I'll let you go first.
Or paramedic, what are some traits that you think make a person really good at being a paramedic or just joining the fire service in general?
We recruit all of our paramedic students from the fire department. And so all paramedic students have already had some experience being firefighters, and we do kind of get to know the people beforehand. And the types of people that are going to be successful and the types of people that we like, one, are definitely not afraid of work. The paramedics in Seattle stay pretty busy, and so you have to like working. The result of that work is always rewarding, but you can't be afraid of working. The second character trait is somebody who's just curious about people. A big part of being a paramedic is determining what's going on here? Like, why is this person feeling this way? Or why are they unconscious? Or how did this come to be? And a lot of that is figured out through conversations with that patient, critical conversations in these moments, knowing what questions to ask, what to listen for, how to help a layperson, tell you what is going on with them in this kind of medical context. So somebody who's curious and somebody who wants to learn. This job of being a paramedic, medicine is a continuously evolving subject. And so all the things that you learn in paramedic school, which is a lot, will change over time. As new studies come out, new evidence-based medicine shows that we should be doing this instead of this. Your job, the things you do, the tools that you use, the medicines that you give people, they're going to change all the time. And in order to continue to do this job, you just have to be ready to learn all the time. These are things I think that maybe not for everybody, but they're really exciting. The learning, the working, accepting that challenge, being curious about people. Those are things that will definitely attract somebody to this job and then also keep you happy doing it.
Anything to add?
For me, for Help One is just the same thing. We pick with our own department, firefighters that are already in the department. They have to be, after probation, they can apply to Help One. But we want individuals, they have a team mindset. They're willing to work with like the case manager and be able, because the case manager is pretty much our boss. Even though I'm a lieutenant at a fire company, she or he is the one giving me the orders when they're on Help One. They're the ones leading the thing, unless we see something medically that we have to step in as a firefighters or EMTs. So good teamwork mindset, not be afraid of working in a dirty environment. Because sometimes we go see these people in hoarding conditions and there's pretty nasty smells and all that stuff, but you just got to have an open mindset that, for them it's totally normal. Or they got used to being that normal, and it's our job to kind of help and slowly for surely make it better. That's what we're there, to make it better. So I think it's very unique. The kind of people that work at Help One, they just want to make better things for other, they kind of unforgiven. So, yeah.
Lastly, I'm opening this question up to both of you. I mean, for people that are considering a career in the fire service, what do you want them to know about joining the fire service and about the option for programs like both of you are a part of?
Oh, it's okay? Awesome.
Yes, sir.
Yeah. I said it earlier, I kind of decided I wanted to do this job when I was I didn't know anything. I was a 5-year-old. And what I discovered is that this job and all the different things you can do in it are exceptionally rewarding. It is something that no matter how long you do this, no matter what happens on each day, you can always feel good about what it is that you do. Like, you can feel good about what you did on this particular shift, or just what it is that you've done over the course of your career. It's different every single day. I love that part of it. I show up to work and you don't even know what you're gonna encounter. There's slow days where you spend a lot of time with the person that you work with and you get to know each other and you have some great conversations, and then every so often you get to go out and kind of do something cool with that person. But then you have other days that are just busy. They're so busy, and in those busy days, you see everything. You see every part of the city. You see every type of person that lives here. You see people that have come in just to visit. You see people who are really having their worst day. And at the end of it all, you've done something. Maybe you didn't fix every part of the problem, but you've done something. There's so many ways you can do that in this department. This is the way that I chose, being a paramedic, and for me it works really great. But we need people to do all the different jobs: the rescue teams, the hazmat team, the paramedics, the firefighters on the engine and the ladder truck. We need all of these people. And because we're such a large and diverse department, I'm sure that you can find something here that's going to give you that feeling.
Do you have anything to add?
Yeah, for me, the advice I give is do your homework, prepare yourself. You got a competition, but you got to be able to tell us what's so unique about you that the other candidates don't have. And that only comes from you digging inside your heart and figure out why you want this job. And once you find the answer to that, then nothing is impossible. Says the guy that take the test for 10 years, never give up. But now I'm just loving it. I work with a great group of people. I got myself a second family. I'm able to provide to my family, and I love my job.
Awesome. I mean, two really amazing stories about how you ended up doing what you're doing and why it's so fulfilling for you. So thank you both so much. And just a reminder, the application window opens October 4th. Go ahead and visit seattlefirejobs.com for more information just about, in general, applications and all that stuff. And once again, I just want to say thank you to Senior Paramedic Alan Goto, as well as Lieutenant Leonardo Castañeda.
Thank you for the opportunity.
No, thank you both so much for being so open and sharing your stories. It's so important for people to understand who the people are that work in this department and different options. So we really appreciate it. Thank you all so much for joining us.